Last night, we were informed of one new border-related positive COVID-19 case. This new case is a 24-year-old worker at the Grand Millennium managed isolation facility whose positive test result was following a test on Tuesday. The case is reporting having had a sore throat 4 days ago, and this person has not yet been vaccinated. The PCR swab returned high CT values of 33 and 35, so around the mid-30s. This can mean either that they are early on in their infection, or that they are nearing the end of their infection, or that it is an historical case. An urgent repeat PCR test and blood serology are being carried out today to give us a better understanding of just what the picture is here. The person lives alone, but Auckland Regional Public Health is investigating whether there has been any contact with people in adjoining accommodation. The case travels to work by private vehicle with a colleague. This colleague was informed last evening as well that they are a close contact and they are self-isolating at home. I should say the case's colleague has been fully vaccinated and will be having a swab taken today. So Auckland Regional Public Health officials have this morning carried out the scoping interviews with the case to determine any potential locations of interest. And at this stage, there are none to report. The case worked over Easter and appears to have worked night shifts over the Easter period and was not at work yesterday and did not visit anyone yesterday. If and when locations of interest are identified, we will notify those, including on the ministry website, and we will send out any push notifications via the app to people who may have been at those locations at the relevant times. So whole genome sequencing on the case's test sample has been started. However, because there is a high CT value in the mid-30s, this means the person is likely to have a low viral load and the sequencing run therefore takes more time if it is going to be successful, and we're not expecting it to be completed until tomorrow afternoon. But ESR will look to run a further, faster whole genome sequencing if today's PCR test shows a lower CT value, which would imply a higher viral load and the likelihood of being able to get a result more quickly. So back to the Grand Millennium, you will be aware we previously reported a couple of weeks ago a cleaner at this hotel had tested positive for COVID-19. That was on the 22nd of March. The whole genome sequencing results for that case indicated it was the B117 variant, the one first identified in the UK, and that was found to be a close match to that of a returnee who had stayed at that facility, but the exact epidemiological link has not been able to be established. So saying, because of that earlier case and the case we're talking about today, we have decided to carry out an out-of-cycle infection prevention and control audit at the facility, similar to those previously done at the Pullman and the Grand Mercure facilities. We've also called a meeting of the Managed Isolation and Quarantine Technical Advisory Group about this case to provide a check and advice on the actions underway at the facility.